Hey everyone, and welcome back for another deep dive. Today, we're going to be tackling something that I think a lot of people are curious about. It's stroke,
Oh, yeah.
specifically prevention and recovery.
Oh,
We've got two really in-depth medical guides with us, and they both kind of take a modern but also holistic approach.
interesting.
So get ready for some fascinating insights into things like, why they say time is brain when it comes to stroke,
Right.
and also how things like fasting and honey might actually play a role.
Yeah, those are definitely some intriguing aspects that we'll be exploring today.
For sure. I think when a lot of people hear stroke, they think, oh, that's an older person's thing.
Right.
But it can affect anyone at any age, and
Yeah,
that's a little scary, right?
absolutely.
All
It
right.
can. A stroke is really kind of like a brain attack
Okay.
because it all boils down to blood flow. When that
Oh.
flow of blood to the brain is interrupted, well, then brain cells are deprived of oxygen and they start dying off really quickly.
So, like, if I'm understanding this correctly, there are a couple of ways that this brain attack can actually happen.
Exactly. The most common type, and it actually makes up a surprising 85% of cases, is called an ischemic stroke.
Okay.
And this is where a clot blocks a blood vessel,
Uh-huh.
essentially causing a traffic jam in the brain.
Okay, so that makes sense. A blocked road means nothing can get through. What about the other type of stroke?
Right. The other type is called a hemorrhagic stroke,
Okay.
and this one is caused by a blood vessel bursting, much like a pipe breaking and causing a flood.
Oh, wow.
This type is less common, but it can be just as serious.
Wow, that 85% statistic really highlights how important it is to be able to recognize the signs of a stroke so you can act quickly.
I couldn't agree more.
Right.
That's why knowing the FAST acronym can literally be a lifesaver.
Yeah. I've definitely heard of FAST,
Yeah.
but a refresher is always good. What does it stand for again?
So it stands for face drooping, arm weakness, speech difficulty, and time to call 911.
So let's say someone's having trouble smiling, their arm suddenly feels weak, or their speech is slurred.
Mm-hmm.
Those are all red flags to call for help immediately.
Precisely. Every second counts.
Wow.
The faster someone having a stroke receives medical attention, the better their chances are of minimizing that damage to the brain,
Right.
even if the symptoms disappear quickly,
Okay.
which could be what's called a transient ischemic attack, or TIA.
Oh, okay.
It's still incredibly important to seek medical attention.
Like your body's sending you a serious warning signal, even if it's brief.
Exactly.
Now, moving on to what causes these brain traffic jams in the first place.
Right.
I know some common culprits are high blood pressure, diabetes.
Yes, and atherosclerosis, which is basically the buildup of plaque in your arteries.
Right.
Think of it like your pipes getting clogged.
Okay.
Atrial fibrillation is another factor.
Okay. Atrial fibrillation, that one sounds a bit complicated.
Sure.
Can you break it down for us?
Certainly. Atrial fibrillation is essentially an irregular heartbeat.
Oh.
This can cause blood to pool, which increases the risk of clots forming. And then these clots can travel to the brain and lead to a stroke.
So it's like your heart isn't pumping smoothly and consistently, which then creates the potential for problems.
Exactly. And then you have diabetes, where chronically high blood sugar levels can actually damage blood vessels over time.
Mm-hmm.
This makes them more prone to developing clots or even rupturing.
It's a good reminder that maintaining good overall health is directly linked to brain health.
Absolutely.
But here's where things get really interesting, especially since you're interested in holistic approaches.
Yeah.
In addition to conventional treatments for stroke, our sources talk about fasting and using honey.
Mm-hmm.
Like what?
Yeah, what's fascinating here is how different approaches can potentially work together to prevent and address stroke.
Right.
It's not always one or the other.
You mentioned fasting.
Yeah.
What role could that possibly play in stroke?
Well, while research is still emerging, there's a growing body of evidence suggesting that fasting might provide some real benefits. Fasting can help regulate blood pressure, cholesterol, and blood sugar, all major players in stroke risk.
Right.
Think of it as a way to reboot your body's systems.
So by incorporating periods of fasting, you could potentially reduce the likelihood of those brain traffic jams we talked about.
Potentially, yeah.
That's pretty amazing. What about honey? I know it has lots of health benefits, but I hadn't considered its connection to stroke.
Right. Well, honey, especially certain varieties like Manuka honey, is packed with antioxidants,
Okay.
and it boasts really strong anti-inflammatory properties.
Huh.
And remember, inflammation is a key factor in many chronic diseases, stroke included.
Are there other types of honey that have similar benefits?
Manuka honey is definitely one of the more well-studied varieties when it comes to these properties.
Okay.
But in general, raw honey appears to offer a wider range of benefits compared to processed honey.
Gotcha.
So that's something to keep in mind.
It sounds like honey could be a simple and delicious way to combat inflammation and help protect the brain.
Possibly, yeah.
I'm ready to start adding it to everything. But I also know we have to emphasize that while these are promising avenues, more research is needed.
Absolutely. It's important to remember that integrating these practices alongside conventional medical advice is key, not replacing it altogether.
Right, for sure.
Yeah, it's all about finding that balance and working with your healthcare professional to develop a plan that's right for you.
Speaking of medical professionals, let's talk about what happens after a stroke. Our sources detail these 7 stages of recovery.
Yeah,
Can you walk us through those?
certainly. The first stage is what we call flaccidity, where there's very little voluntary movement.
So almost like a temporary paralysis?
Yes, that's a
Yeah.
good way to put it. Next comes spasticity,
Okay.
where muscles become stiff.
Oh, okay.
And then this stiffness will gradually increase over time,
Okay.
and then eventually begin to decrease as movement starts to improve.
That sounds like a bit of a roller coaster in terms of muscle control.
You could say that.
Yeah.
As that spasticity decreases, you'll then start to see more isolated joint movements. Gotcha. With continued therapy and effort, there's the potential for normal movement to return.
It sounds like a challenging road, but it's encouraging to hear that progress and even near full recovery is possible for some people.
Absolutely. It's important to stay hopeful and focus on what can be achieved through rehabilitation.
I imagine rehabilitation is a key part of that recovery process.
It is.
What does that typically involve?
Well, there are several key components to stroke rehabilitation.
Mm-hmm.
Physical therapy helps to restore motor skills and mobility.
Right.
Occupational therapy focuses on regaining those everyday skills that are needed for daily living.
Okay.
Speech therapy can address any difficulties with communication or swallowing,
Right.
and psychological support is also crucial.
Psychological support, that's not something I would have immediately thought of.
I know, right?
Mm.
But a stroke can have a significant impact on someone's emotional and cognitive well-being.
Right.
So providing the right support in these areas can be really important.
It sounds like it takes a multifaceted approach to truly address all aspects of recovery.
Exactly. It's about healing the whole person, not just focusing on the physical aspects.
Mm-hmm.
Therapists, medical professionals, and loved ones can all play a vital role in supporting that individual's recovery journey.
Earlier, we talked about how acting fast is crucial when someone's having a stroke.
Yeah.
What are some of the modern medical treatments that are making a difference in stroke care today?
So for ischemic strokes,
Right.
where there's a clot blocking that blood flow to the brain,
Yeah.
one of the gold standard treatments is TPA, or tissue plasminogen activator.
I've heard that referred to as a clot-busting medication.
Yeah.
What exactly is it doing?
Well, you could think of it as a powerful drain cleaner for your brain's blood vessels.
Okay.
It works by essentially dissolving the clot and restoring that crucial blood flow.
Mm-hmm.
But the key is it needs to be administered within a specific time frame,
Okay.
ideally within a few hours of when the symptoms first started.
So again, that highlights why calling 911 immediately is so important.
Exactly. But even if someone misses that window for TPA,
Right.
there's another treatment option called a mechanical thrombectomy.
I remember reading about that in the medical guides. It's a minimally invasive procedure, right?
It is. Picture a tiny device being threaded through a blood vessel all the way to the brain.
Oh, wow.
It then grabs the clot and pulls it out, restoring that blood flow.
Wow.
It's a remarkable procedure.
It sounds almost futuristic. Are there guidelines around when these different treatments are recommended?
Yes. The 2024 stroke treatment guidelines emphasize the importance of early intervention with these advanced techniques.
Okay.
And they also highlight a shift toward not just treating the stroke itself, but also focusing on a more comprehensive approach to rehabilitation.
So it's about focusing on the whole picture,
Mm.
treating the stroke in the moment, and then helping that individual recover and thrive long term.
Precisely. There are many exciting advances being made in stroke rehabilitation, in addition to the traditional therapies like physical, occupational, and speech therapy.
Right.
For instance, there's constraint-induced movement therapy
Okay.
and virtual reality rehabilitation.
Constraint-induced movement therapy. I'm not familiar with that one. What does it entail?
It's a fascinating approach where the unaffected limb is restrained,
Oh, okay.
forcing the individual to use the weaker limb.
Okay.
This essentially retrains the brain to create new connections.
Wow.
It pushes the brain out of its comfort zone to encourage what we call neuroplasticity, which is the brain's ability to rewire itself.
I can see how that would force the brain to adapt and learn.
Mm.
What about virtual reality rehabilitation?
Well, this one leverages immersive virtual environments to engage patients in therapeutic exercises and games.
Oh, cool.
It can make rehabilitation more engaging and motivating
Okay.
while targeting specific movements and skills.
So it's kind of like playing video games for recovery.
You could say that.
That's really cool.
Yeah, I think it speaks to how technology is being creatively used to help people regain their independence and improve their quality of life after a stroke.
Let's circle back to those holistic approaches we discussed earlier, fasting and honey.
Yeah.
Can you elaborate on the potential benefits of these practices in terms of both prevention and recovery?
Certainly. We know that fasting has been shown to have positive effects on cardiovascular health.
Okay.
It can help regulate blood pressure, cholesterol, and blood sugar,
Mm-hmm.
all of which play a role in stroke risk.
Right.
So it's like giving your body a chance to reset and get those key numbers back on track.
Exactly.
And what's really interesting is that fasting seems to trigger a process called autophagy.
What is autophagy exactly?
It's essentially the body's way of cleaning and recycling cells.
Okay.
Damaged components are removed, and healthy renewal is encouraged.
Hmm.
This process is crucial for brain health and may even contribute to recovery after a stroke.
So it's like hitting the refresh button on your cells.
Yes, that's a good analogy.
Yeah.
Now, honey, as we mentioned before, is rich in antioxidants and anti-inflammatory compounds.
I'm hearing that raw honey is the way to go.
Yeah.
Is that accurate?
Yes. Raw honey seems to retain a wider range of beneficial compounds compared to processed honey.
Gotcha.
And these properties could be particularly important in protecting brain cells from damage and reducing inflammation, both in terms of preventing a stroke and supporting recovery afterward.
It's like honey has a superpower that extends beyond just its delicious taste.
It really does. While more research is needed, the potential of honey to positively impact brain health is quite compelling.
It's amazing to see how these ancient practices are being explored through a modern scientific lens.
It's a great reminder that there's always more to learn and that combining wisdom from different traditions can lead to new and innovative approaches to health and healing.
Okay, so we've covered a lot of ground, understanding the different types of stroke,
Yeah.
why acting quickly is so vital, diving into modern treatments,
Mm-hmm.
and even exploring the world of holistic approaches.
All right.
It feels like there's a lot to digest.
It's definitely a lot of information, but also a lot of empowering information.
Right.
The more you understand about stroke, the more equipped you are to take proactive steps for yourself and your loved ones.
I think that's a really important point. Knowledge is power,
Absolutely.
and it can give you a sense of agency over your health.
Yeah, it feels like we've gone from like stroke 101 all the way to some really cutting edge stuff,
Yeah.
which is awesome. But I think now's a good time to shift gears and talk about what people can actually do to reduce their risk.
Absolutely. Let's empower people to take action.
Right.
Prevention really is key when it comes to stroke.
Our sources seem to really stress that a lot of it boils down to making healthy lifestyle choices.
Yeah.
What are some of the biggest things that people can do to support their brain health?
Well, think of it like building a strong foundation for your brain.
Okay.
And it starts with a heart-healthy diet, one that's rich in fruits and vegetables, whole grains, and healthy fats. So ditching the processed food and loading up on those brain-boosting nutrients.
Exactly.
And I can't imagine we're going to have this conversation without talking about exercise.
You're absolutely right. Regular physical activity is a must.
Mm-hmm.
Aim for at least 30 minutes of moderate intensity exercise on most days of the week.
Okay.
It doesn't have to be anything crazy, brisk walking, swimming, dancing,
Right.
anything that gets your heart rate up and improves that blood flow.
Movement is medicine. I love that. And speaking of medicine, our sources also emphasize the importance of managing any underlying health conditions.
Yes, things like high blood pressure, high cholesterol, diabetes, these are all major risk factors for stroke.
Right.
Working closely with your healthcare provider to manage those conditions is crucial.
Yeah.
It might involve medication, lifestyle changes, or a combination of both.
And we can't forget those lifestyle factors that are often within our control to change: smoking and excessive alcohol consumption.
Yeah, those two habits really don't do your brain any favors. Quitting smoking is one of the best gifts you can give yourself and your brain.
Right.
And with alcohol, moderation is key.
I think it's really encouraging that even small changes can add up to make a big difference over time.
Oh, absolutely.
You know, it's never too late to start prioritizing your health.
I completely agree. Every positive step you take towards a healthier lifestyle is a step towards protecting your brain. Even if you've already had a stroke, Adopting healthy habits can make a significant difference in reducing the risk of another one.
It's about reclaiming your health and having that power to positively impact your future.
Hmm.
It's not just about preventing disease. It's about living a life that's vibrant and full of possibilities.
That's a great way to put it. It's about having the energy and vitality to pursue your passions, spend quality time with loved ones, and embrace each day.
It's about adding life to your years, not just years to your life.
Exactly. As we wrap up this deep dive, I want to leave our listener with a final thought to ponder.
Okay.
We've covered a lot of ground, from the science behind stroke to the potential of holistic practices and everything in between.
Now it's time to take that knowledge and put it into action.
Right.
Small steps can lead to big changes.
So I'll leave you with this question. What's one small, healthy change you can make today to support your brain and reduce your risk of stroke? It could be swapping a sugary drink for water, taking a walk during your lunch break, incorporating some honey into your diet,
Right.
or anything else that resonates with you.
Every little bit counts. There's no better time to start than now.
Remember, you deserve to live a long, healthy, and fulfilling life.
Absolutely.
Take care of your amazing brain, and it will take care of you.
Thank you so much for joining us on this deep dive into the world of stroke. We hope you found it informative, empowering, and inspiring. Until next time, keep learning, keep exploring, and keep taking care of yourselves.